Let's get the latest from Washington now, because the United States has recorded a record number of COVID-19 positive cases. President Joe Biden last year announced measures to try and bring the numbers down. For more, we're joined by correspondent Kate Fisher. Kate, thank you for being with us. Just tell us about the latest stats.
Yeah, this is actually a record-breaking number of people hospitalized by COVID-19. Today, the total stands at 145,982 people in the United States, which breaks the previous record, which was set last January, just over 142,000 on that day. A huge leap in the number of people being hospitalized, 61,584,415 cases total in the US since the beginning of the pandemic, and this is only rising with this Omicron variant surge. Disease modelers who say that they do their best to forecast the number of people that will become infected, but of course there is so much unknown about coronavirus. But they suggest that despite these huge numbers occurring at the moment, we are not yet at the peak here in the US, and they're expecting that by the end of this month we could see total hospitalizations in the region of 275,000 to 300,000 people, which is clearly putting an enormous strain on the medical healthcare system here.
Sure. And is it clear that this is being driven by Omicron now? I mean, initially we were banned from travel, and we knew that Omicron spread very quickly in Europe, but the US was desperately trying to keep the numbers down. To what extent is Omicron pushing this now?
Yeah, the most prevalent variant in the US is Omicron, and it is the fact that it is so contagious which is causing these numbers, and of course the fact that there is still a significant amount of the population who are not getting vaccinated. The Biden administration is Many critics are saying it's playing catch up with how to deal with the Omicron surge. It's trying to get a hold of more rapid tests, something that the US hasn't really had a handle on until this point. The Biden administration saying that people will be able to get up to eight free tests, rapid tests, under their insurance policies, their medical insurance policies. They are also increasing the number of the antibody treatment, the new antibody treatment that's been developed. They're buying 600,000 more doses of that to try to help people who have already contracted the virus, and they're considering making the recommendation being that cloth masks are no longer enough, and they are weighing whether to say to the American public that they need to be wearing N95 masks or KN95 masks to protect themselves. Of course, the problem there again is a supply chain problem. Are there enough of these masks available for the American public to go and purchase them?
Yeah. That high hospitalization rate that you spoke about, is that a concern? Because the hope was, given the early stats, that there was this disconnection between high infection rates and hospitalizations and deaths. Many experts saying that Omicron seemed to be milder, less often leading to hospitalization and death. So is that assessment now in doubt based on the latest stats?
I don't think so. I think that remains the case, and the message being given by the administration is that if you are vaccinated and boosted, then your likelihood of being seriously ill from COVID is much less reduced. I think this huge the huge numbers we're seeing is because simply Omicron infects more people more quickly, and it's just the law of averages, if you like. The more people that are infected will increase the number of people hospitalized, however serious it is, because there are just so many more people who are contracting the virus. And that's the big concern. Many health authorities and many health systems already saying that they are having to cut back on other on treating other patients with other illnesses because they are being so overwhelmed by COVID. Also telling people that unless they are incredibly ill, then they will not be admitted to hospital because they don't have enough space for them. And of course, because it is so contagious, one of the issues for the hospital systems is that so many members of their staff are contracting it, which means there are less people available to treat patients who do make it into the hospital.
All right, thank you for that update. And I'd love to chat to you about the implications for Joe Biden's administration. We'll get to that next time. Thank you. Live from Washington, Kate Fisher. Now, the EU